A hearty good evening and welcome to a session on common challenges during breastfeeding. We are glad to have Dr. Girija Reddy among us today to help us explore this topic. Breastfeeding is one of the most important functions for a new mother, and breast milk is an optimal source of nutrition for any newborn baby. It meets almost all of the nutritional value for a full term baby until approximately 6 months of age. But during this journey, a breastfeeding mother can go through some problems, such as latching problems, inadequate milk productions, nipple soreness, and engorgement, and a lot more. So the doctor will take us through this common challenges and help us understand more about breastfeeding in this special month. Doctor, you have the stage.
Yeah, done. Thank you so much. So good evening, all. Hope all of you are doing great. And today in this session, I'm going to discuss with you about what are the normal common challenges that you will be experiencing during your breastfeeding journey. I hope this is going to be useful for the first time mothers and for the one who are going to expect your delivery within a month or 2 months. Most of you know like what are the benefits of giving breastfeeding for your baby. You know what are the benefits for you as well as for baby. But there were few challenges that you will come across once you delivered the baby and maybe during your pregnancy that may put you into the situation that like can I continue with the breastfeeding or any solution to avoid these issues, and how you can continue with the breastfeeding journey that I will just explain to you. As you know, breastfeeding is something that you are going to give all the optimal nutrition for your baby in the first 6 months of time. Okay, so when it comes to like immediately after the delivery, the most common question that you will be having: how am I going to produce milk immediately after the delivery? Because you are not having the milk like during your labor time, or you are in the ninth month, you are not seeing anything, and immediately after delivery, are you going to produce milk or not? Okay, yes, that is one of the basic challenge for most of them. I will say too low milk supply. That is what even when I visit the patient, that they will say in the first day or within 24 hours, they say, "No, ma'am, like I'm not producing any milk. I won't think the baby will be getting enough." And after every feeding, my baby is crying excessively. Uh, for this, my answer was no. Not all the mother will have low milk supply after your delivery. So as I told you, breastfeeding is something natural process of your natural process of your body after your delivery. Immediately once the baby comes out, there will be cessation of that progesterone, and that is where you are going to produce your milk. If I say again, for few mothers, they were going to produce milk even in the ninth month of pregnancy, where they will have a small quantity of colostrum milk. And immediately after the delivery, yes, you feel like the baby is awake and the baby is asking for feeding within 1.5 hours or 2 hours. And you feel that the baby was not enough with the milk that you are giving. But what I will say was, the first day and day two, you will be not producing enough milk. That was all the colostrum, which is going to be very, very less in quantity. Okay, so why the baby latches for longer time was, the newborn needs your body warmthness, the newborn needs your comfort, and the baby wanted to latch on the breast, because whenever the baby is latching, it's going to pacify the baby. It is like if you are giving any pacifier to them, they will be like being very calm, and they will latch, they will suck on that for some time, and they will be sleeping, and again they will get up. So it is most common in the first day, second day, third day, the baby will take feedings frequently. And I can say around 2 to 3 hours in 24 hours of time, you are going to spend your time with your baby during the breastfeeding. Okay, that's common for all the new mothers, even for the second time mothers also. You are feeding frequently after you were feeding, the baby was crying. That doesn't mean that you are having low milk supply. Okay, but there were conditions. For example, you are a mother who has type 2 diabetes mellitus, which is like not during the pregnancy again. So during the pregnancy you have diabetes, that doesn't impact your supply. But you have it, the diabetes during pregnancy, yes, it might. And for few, maybe they were obese. As you know, the obesity is something which is going to completely change your hormonal issues. Okay, as you might know, the issues with obesity and its relation with the endocrinology, means the hormonal dealing, it's completely like too much. I can say the mother who were obese or the pregnant women who were obese, they were going to have a lot of complications. Maybe out of them, one or two, because of obesity, the hormones are not producing properly, and you might have low milk supply. Yes, I can understand. And you have delivered the baby at 2 weeks or 3 weeks priorly, like you delivered 33rd week, 34th week. Yes, I can expect you having low milk supply. But what I will suggest you was, not everyone will have low milk supply. Out of 30, I say only 2 or 3 will be having low milk supply. Like if I say 1 is to 10 ratio, okay, so 1 is to 10 ratio will be having delay in milk supply. The first 2 days, 3 days, yes, the milk supply is going to be less. And where we can help you out to produce the milk, like what all can be done, like giving skin to skin contact and adding some good galactogags, as well as we can help you with the nutritions that you require during your pregnancy. Okay, so this is what you need to do in case you are a mother with low milk supply. And later on, maybe in the first month and second month, most of people will say that they will come back to the OPD and saying that my milk is not sufficient for the baby again because I'm not getting leakage. So leakage, that doesn't mean like you are having enough milk. If you have leakage, it means you are producing more than what your baby requires. Okay, so that shouldn't be there after 1 month. Okay, so needs to check. Always the mother's perception is completely different from the way you from the way that we will deal you. Okay, you feel that there is low milk supply, come back to us and make sure that you are producing enough milk or not. There were few conditions, again I'm telling you, maybe the stress you are going through that, and the lack of sleep. I know that the first few months is very difficulty for the new mothers to take care of your baby. So that stress or lack of sleep and food, that whatever you will be taking, that might sometimes change your milk supply. So in that cases, again we can help you with other things to produce enough milk for your baby. Okay, so that is one thing. And if you wanted to produce enough milk, the natural way of producing enough was, start pumping your milk. You are producing it or not. Whenever you are doing that pumping, it's going to activate your hormones like oxytocin and prolactin, which is going to help you to produce milk. Okay, and the next one, let the baby to latch. Even though you feel that there is no secretions, it is very important for you to maintain good emotional bonding and physical bonding with your baby. Okay, that is very important. The baby should be comfortable when they comes to you. Okay, so make sure you are giving frequent feedings. That's irrelevant of your milk supply. Okay, so that is how you can able to maintain. And still you couldn't able to deal with that, yes, we were here to support you in case of low milk supply. And now the next one, high milk supply. Again, this is one of the common thing. If you are a first time mother or even the second time mother also, you can see there is oversupply of milk sometimes, where you will be having leakage continuously and you are using 1 or 2 pads, and it is getting wet within half an hour. Okay, so that is something going to disturb your feeding pattern, your baby feeding pattern also. Like in case you are trying to feed your baby, the milk quantity is very higher, the baby is just sucking, the baby gets lot of milk, they cannot able to take it at a time. Okay, and the baby is trying to suck, the milk starts leaking, the baby will not get any grip to latch on the breast, because latching is something the baby needs to completely take the nipple portion and the areola along with that, and this is how they need to latch. If there is low milk supply, it starts leaking, the baby will not suck, as whatever milk it's coming from the breast, no, they start leaking. And that's not going to help the baby to get enough nutrition, and the baby will be not comfortable, because sucking is going to help the baby to soothe them. Okay, not by taking only the milk. Okay, so the baby needs to suck. Okay, and the milk starts leaking, and for few babies, maybe there were preterm babies or some babies with the low birth weight, when there is low milk supply and you are trying to give the direct breastfeeding, sometimes that is going to cause the choking also. Like same, like in case if we were having a lot of water at a stretch, how it feels. In the same way, when they were sucking, it's over milk supply, and that's going to cause any issues, and the baby is not latching completely though. Yes, you need to deal with that also. In case of over milk supply, I wanted you to sit, lean back and feed, so the gravity will helps you to have the lesser flow. And before the feeding, always extract your milk. Okay, extract some 30 to 40 ml of milk, keep it aside, and then let the baby to latch on. If not, the baby is not going to be comfortable with your breast. So make sure about it. Extract your milk. If it is low milk supply, lean back and then feed your baby and holding your breast. That is also very important. For example, like you have given free access to the baby starts sucking somewhere else. If you hold the breast in V shape or U shape, okay, the milk flow will be regulated. Okay, so because of that regulated milk flow, the baby can able to latch it well. Okay, so once you have this over milk supply, no, these symptoms are going to be there for a month or 2 months, and for few it may take longer time also. So the best suggestion for this oversupply milk was continue with the same feedings. If you feel the milk supply is too much, okay, and you can either donate your milk. If not, you can use the lactation suppressants. Like there were few medications which is going to reduce your milk flow. So those can be prescribed in case you have that over milk supply. Okay, so that is for low milk supply and higher milk supply. Now, coming to the next most common challenge immediately after the delivery, the nipple pain. So, I think I can say from the patients that I see, the day one and day two, even the second time mothers, what they will say, yes, ma'am, I have some pain on the nipple and there is a little bleeding also, but it is fine because it is normal to have the nipple pain during your breastfeeding process. I will say no, no nipple pain during your breastfeeding time. If you are experiencing any kind of nipple pain, it is a clear sign that somewhere you are not feeding your baby properly, and that's going to cause baby's weight loss, and that's going to end up with lot of cracks and bleeding on the nipple, and then like because of all this pain and discomforts, that's going to reduces your milk supply also. Okay, make sure, I think if you have already delivered, you know what is good latch, and you need to make sure that you are not experiencing any kind of pain. Okay, so breastfeeding is not going to be painful for you until unless you follow the proper techniques. Somewhere you have missed the techniques, and the way you are positioning the baby is not good, the baby is not taking your feeds properly. Yes, that was the time you experience nipple pain and cracks and bleeding. Okay, so I will say always having a little sensitivity is fine because the baby is sucking for some time, and because of the sucking for 20 minutes you are having little bit sensitivity to fine. But pain after your breastfeeding, and you can see the compression and the cracks on the nipple and redness, it is a clear sign that you have missed something. Okay, make sure you are meeting a lactation consultant and check, like get it done your assessment and baby assessment, how the baby is sucking, and was the baby taking your milk properly or not. And if there is any cracks and bleeding still even after good feeding though, you can apply some nip care ointments or any other kind of naturally there will be coconut oil or mm, butter or ghee, these can be applied. If the injury is too much and there is severe bleeding, for them I will say 1 day or 2 days stop giving feeding for your baby. Okay, so not the direct breastfeeding, but there is milk. What you need to do, you need to extract your milk. Okay, instead of giving direct breastfeeding, extract your milk and feed your baby. Let the cracks and bleeding it should be reduced, then you go for direct breastfeeding. Meanwhile, once or twice nip care ointments can be applied. And don't think that having a nipple pain during the breastfeeding is normal. Of course it is not, because that's going to end up with lot of complications later on. Okay, so mostly the nipple pain is because of improper sucking. For few, very few, it could be because of infections. Maybe there is bacterial infection or fungal infection or some other things. Yes, you can see the redness on the nipple, and along with that, you can see redness along with some kind of discomfort. Okay, so for that you need to consult with the gynecologist and take proper antibiotic treatment as well. Along with that, continue with your direct breastfeeding also. Okay. And the treatment for this was, as I told you, clean your sorry apply the nip care ointments and all. And along with that, make sure you are cleaning your breast in a day once or twice. So it is not advisable for any mother to clean or to completely wipe your breast after your every breastfeeding. It is not required. In a day once or twice, if you do, I will say it is good enough. And in a day once or twice. The more you are using soap water, the more you are using wet tissues or something, that's not going to keep your breast hygiene. Okay, breast hygiene is not something you need to clean and do the washing every time after your feeding and before your feeding. Of course it is not required, because the breast milk has the capacity where it can relieve the soreness and it can relieve the cracks and pain, everything. Okay, so not to clean your breast every time. And make sure you are applying a little fresh expressed milk over the breast itself. And along with that, maintain the breast hygiene. So sometimes you are wearing uncomfortable maternity wear, and sometimes it is wet clothes or something you are wearing. Yes, again, that's going to cause you the infection. So make sure you are using that. And sometimes because of breast pads also, you have oversupply and you are keeping that breast pads for 3 hours, 4 hours continuously, even though if it is moistened. So that is not advisable. So change that. And change the creams also. For few it is normal that they will be applying some nipple creams or the mother breast creams and all. I won't think it is required until unless you have any other issues. You have the nip cracks or pain, and you are using any kind of nipple creams or breast creams. Try to stop that and you can see the change. Okay. And when you feel the pain, you make sure you are going and meeting a lactation consultant. And the breastfeeding position needs to be changed. Okay, so the nipple cracks you need to manage, and all you are experiencing it because lack of knowledge about the breastfeeding. So that is one thing. And now the next one more common challenge was the engorgement. So engorgement is nothing but you are producing lot of milk, especially in the third day, fourth day, and fifth day. Okay, so you will be having that the cholesterol milk, and it stores in the breast. Okay, and when you touch your breast, it is painful. It is super hard, and after a day or something, you feel a kind of feverish, and breast will be very heavy. You are finding difficulty to do your activities, which means you are producing a lot of milk. Okay, so during that engorgement, what you need to do, so it is a natural process of producing your milk. When you have engorgement, it means you are going to produce enough milk for your baby. Okay, but make sure you are producing, and you are feeding the same thing for your baby, and you are not extracting your milk. It is not. Make sure once you are done with the feeding, you need to do the breast massage. Make sure you are extracting your milk. Once you are done with the feeding, once you have extracted your milk, you should feel that difference. Okay, make sure the breast is not hard. It should be soft after your breastfeeding and extraction of milk. Clear? So the first 1 week after your delivery, this was the most common challenge that you experience it. So extract your milk by using the breast pump, or and keep the hot water bag and do a little massages. That's how you can manage with your engorgement. Okay, the first 3 days may you are going to experience it. Sorry, after 3 days, like third, fourth, and fifth day. And after fifth day, mostly it will be the less, and very few mother, there will be milk stasis. You might know what is meant by milk stasis. Milk stasis means there is milk and that was stored in the breast only. Okay, because you are not frequently feeding your baby, and most of the first time mothers, they might felt they fed for 20 minutes. Okay, so they will be thinking that they gave complete feeding, but the baby might suck only the nipple. So there is no transfer of milk from the mother to the baby. Okay, so when there is no transfer, that milk starts storing in the breast. Okay, so that's going to cause you the infection and inflammation later on. Okay, make sure during your total process of your breastfeeding, that 5 months or 6 months, you are not supposed to have any kind of this hardness and this oversupply of milk and this milk stasis. Okay, so if you are experiencing it, you know how to manage it. Extract your milk and make sure you are correcting your baby latch, and make sure you are properly giving your milk to the baby. Okay, you are producing milk, that but that should be reached to the baby. Okay, assess that milk transfer, was your baby taking your milk or not. Okay, so that is one thing. And the next one, breast refusal or latching problems. I will say this is most common in the first 1 week or 2 weeks of time. Okay, where the baby is not liking to latch on your breast. It could be because of various reasons. Okay, could be because your nipple size, which is flat or inverted, the baby might not latch. And the baby has any kind of tongue tie or high palate, which is structural abnormalities, the baby cannot able to latch. And one of the most common reason was uh, like lack of feeding in the first 1 day. So immediately after the delivery, you have not given the breastfeeding properly, and there is no skin to skin contact maintained, and you have introduced any other feeds for the baby, like formula feeding or the donor's milk or something you are giving to your baby. Okay, and that has been given with the bottle or with paladi or spoon, they will have nipple confusion. And newborns, it is very easy for them, like if they were on breastfeeding, no, they doesn't wanted to take formula. For few babies, once they taste the formula, okay, so they doesn't wanted to latch on the breast, because they need to put efforts and they need to latch on the breast and take feeding, it takes half an hour of time. Okay, so it is common for the babies who will be like having the symptoms of latching issues. So you make sure when you are experiencing there is latching issues, try to give lot of skin to skin contact. Okay, and if it is flat nipple or the flat nipple or any kind of inverted nipple, okay, so get help from the lactation consultant, pull the nipple portion and use any kind of shields or holding the breast properly so that the baby can latch. Okay, so just check what is the reason the baby is not sucking. Okay, so that is one thing. And for few it could be because of ear infections also, and for few it could be because of low milk supply. For example, all of a sudden your milk has been reduced because of your higher stress or lack of sleep or whatever it could be. Okay, when the baby is trying to suck, it is less amount of milk. Okay, so the baby was on more demand, the baby is super hungry and there is low amount of milk. And when the baby is trying to latch on the breast, they are not going to be comfortable sometimes. Okay, so that is one thing. And in case if you are having any infections like breast infection or nipple pain or any kind of infection, again the babies are not going to latch on your breast. And one more thing is nursing strikes. So nursing strike, as this name itself it indicates, nursing strike is something like you are feeding your baby continuously, and it's been like 5 months or 6 months or sometimes 1 year, and all of a sudden they will stop taking the feeding from your breast. Okay, so and they won't like to take anything else also. So these could be because of over uses of bottle. You are using the bottle from the second month or third month, it was still continuing, like you are giving your milk and then the bottle feeding. At one point of time they will have the nipple confusion. Okay, so that is the time where they doesn't wanted to latch. And sometimes the smell from the mother's breast, that is also changing. Okay, so make sure your baby doesn't requires any kind of super smell like perfumes or something. The baby is always like the natural order that you get. And especially when they were coming to the breast, no, the breast is going to produce some sebaceous oils. Okay, so that is very important, the baby can able to identify that smell, and that's how they are going to latch. So if you are changing some others, I even I have seen when they change the perfumes or when they change the deodorants or whatever it could be. Okay, that is also going to cause the baby to have this nursing strike. Okay, so make sure in any one of these conditions you are experiencing it, as a mother you can understand why the baby is not latching. Okay, and then take action accordingly. And if I say in the cases of nursing strike or breast latching, I will always say maintain lot of skin to skin contact, give the maximum comfort from your breast. you and your baby sit alone. Okay, so have the room which is dark, and just make sure that you are giving enough like enough comfort for your baby, and slowly slowly. Yeah. So at the end of the day, yes, the baby is going to take feeding from your breast. Okay. So make sure like the baby is latching well, and check for what your baby requires, and do the things accordingly. And crying symptoms, as you might know, crying is something that they do not because of hungry. So not because of hungry that they will be crying. Okay, so crying is something they will be having it at the end of, like, they show the hunger signs, still you doesn't fed the baby, they might cry. But most of the time the crying could be because of lack of comfort and warmthness and the mother's presence. As you know, the newborns require a lot of attention from you. Okay, so if they were not handled secured properly, yes, they will be crying. That doesn't mean that they were hungry. And you can see in the first 1 week or 2 weeks may the baby requires more and more attention from you. And especially in the night times, they doesn't wanted to sleep also. They will be like uh, they will be crying excessively. And sometimes by giving the skin to skin contact, no, that's going to help the baby to relieve the pain. And any kind of illness like any fever or any infection was the baby is having, that will be relieved. And sometimes by giving the skin to skin contact, no, that's going to help the baby to relieve the pain. And yeah, so that's about the session. And if you have any inquiries or any questions, you can ask me now. Ask the patient to wait, I'm in session. Yeah. Yeah, so there were various reasons for the baby, like who was crying. Every time they cry, that doesn't mean that they were hungry. And every time they cry, you don't think that I don't have milk and that was the reason my baby is crying excessively after your feeds. Sometimes even though if it is overfeeding, when they cry, that will help the baby to digest it properly. Okay, so they were crying, still you are feeding your baby, yes, of course you are going to increase your baby discomfort. Okay, so they were crying, check out why they were crying. Is that because of wet diaper or any other things? And try to give lot of skin to skin contact. Not every baby who was crying requires lot of milk. Okay, so it could be because of various reasons. Just check for the baby hunger signs and satisfactory signs, and keep on feeding your baby. And there was any challenges or any issues you are experiencing, and you are not understanding how to uh, like how to avoid those challenges, you can come back and meet a lactation consultant who can help you out to relieve these discomforts. And yeah, so that's about the session. And if you have any inquiries or any questions, that you can ask me now. So from Ruchi, if baby is drinking 10 or 15 minutes and then sleep, if I try to wake him up, the baby will close the mouth strongly. Baby will not drink. Then baby is frequently getting up and then cry for milk in 1 hour or 1.5. Any strategy how to deal with this? So this is something like a cluster feeding pattern, where the baby just wanted to have some amount of milk because they will be comfortable to take small amount of milk, and after that they sleep well, and within 1 hour they will get up. And that's going to continue every time. Okay, so make sure you are giving the continuous proper feeding for your baby. After 15 minutes the baby is sleeping, or after 10 minutes, you need to give some extracted milk or something. Okay, let the baby to have the habit to complete their feeding. Okay, and after that you can see the baby will get up after 2 to 3 hours. 1 or 2 days you continue with direct breastfeeding, and extracted milk after 10 minutes of your direct breastfeeding, and you will not see any kind of these cluster feeding pattern changes. But once or twice, if the baby is taking 1.5 hour or 1 hour once feeding, it is fine. But you are feeding 10 times and 10 times the same thing was happening, yes, you need to change the cluster feeding pattern. So make sure you are giving lot of skin to skin contact, and along with that, extracting your milk and feeding to the baby, so that you will be also confident that you gave the enough milk to the baby. So from Amrita, can we sleep and feed? This is something like I will not say until unless I see how comfortable you are with breastfeeding. I can say the first 2 3 weeks though, I will not suggest any mother to feed your baby in the lying down position, because for the newborns it is easy to latch only on the nipple and they will be sleeping, and the mother, you also will be sleeping. And when the baby is getting enough skin to skin contact, no, when they were getting that warmthness, they will be like really very comfortable, and they won't take the milk, and you can see the baby is not gaining the weight, and you can see some cracks and all. So first 3 weeks 4 weeks not to give feeding in the lying down position. After 3 4 weeks, the baby was a little bigger, the baby is latching well, and you can identify, and you are sure about your feeding process. Once or twice can be given that sideline position, but need to check. Even though you are giving sideline position, you need to burp your baby where you need to sit and do the burping. So check for those things and see. As I told, 3 4 weeks no, and after that it depends on your comfort. The baby is gaining weight, the baby is latching well, and you are comfortable, so that's fine, but not up to 3 4 weeks. Yeah. So from Chaturbala, how to manage first 2 to 3 days after after the delivery? Please suggest. I think yeah. So Maitreyi, I think she might not have delivered it. So yeah. So first 2 to 3 days, I think you will be at hospital immediately after your baby has been born. So we'll be giving first skin to skin contact, and the first feeding will be happen. Like that is irrelevant of your delivery. It could be the C-section or the normal delivery, and later on the feeding pattern will be like feeding on demands, because the few newborns, they will be not comfortable in taking first 12 hours no feeding. But if your baby is being active and baby is properly accepting your feeds, so 2 to 3 hours once you can feed your baby, and staff nurses will be there who can support you in the initial stages of your delivery. Like if it is day 0, you are in C-section and lying down, the staff will be helping you. And the first day, like after 24 hours, you are sitting, you are comfortable, then we will come back and we will let you know like how to feed your baby, and what are the challenges that you are experiencing, and was your milk supply is going to be enough for the baby. And then we will counsel you on how to feed and what are the things that you need to check when you are breastfeeding your baby. So within 2 to 3 days of your feeding, I hope you will be confident and you can continue the same feedings after you went to home. And after 2 3 days you went to home, and again the feeding challenges will start, where you have engorgement and sometimes low milk supply again. And you can have follow up after your delivery on fifth day or sixth day. So mostly the first 5 days you are handling your baby well, so there will be no other issues when it comes to the breastfeeding. Like if you are someone who are going to deliver in Apollo Cradle, so you no need to be worried about it, because we were there to help you. So I think we will counsel you after your discharge, sorry, after your delivery process. Okay. So yeah. So if there was any other questions, or we will end up this session. Okay. So Okay, done. So regarding the food that what you need to take after your delivery, I think there was nothing that you need to take something specifically to improve your milk supply. Everything that you can consider, uh, but there were few foods like fenugreek or garlic and ginger. I think most of the foods what your mom or grandmother will be giving, the same foods you can continue. I think once you delivered, we will let you know what kind of foods that you can take. But there is no restrictions and just try to have 1 or 2 glasses of milk and oats, sabudana, fenugreek, ginger, garlic. These foods can help you. Along with that, I think this is something if a dietitian talk, it would be great. But these foods you can try. I will say most of the foods what your family members will be giving no to maintain your milk supply, those will be good. So continue the same. So, yeah, thank you all.